Care Quality Commission says the workforce is exhausted and depleted, with care providers already having to turn away patients. It says urgent action has to be taken to get through the next few months safely. Well, yesterday, the government did announce an extra £162 million to boost the adult social care workforce. Here's our social affairs editor, Alison Holt.
The unmet need of which today's report warns is already a reality for the cooks. Melvin has a rare brain condition and unable to get any support. Dorothy is caring on her own.
He can't get out of a chair on his own. He can't mobilise on his own. He can't go up and down the stairs on his own. He can't wash, dress, shower. Take your time. It's just full on 24/7 caring.
Melvin was sent home by the NHS in June. For a short time, care workers came in, then they said they didn't have enough staff to continue. That was 12 weeks ago. According to the charity carers, many family carers are being pushed to the edge, like Dorothy.
I'm on my knees. I'm on my knees with exhaustion. The strain of having to do it all on our own. We're left here with nobody. There's no care package, no accessibility to services. We feel completely and utterly isolated and scared.
Today's report from the regulator, the Care Quality Commission, warns of the serious impact staffing shortages are having across the health and care system in England. Job vacancies in care homes have risen from 6 to 10% in 5 months, and nursing homes are deregistering because they can't get nurses. It concludes urgent action is needed.
We're calling for, in our report, increased funding to stabilise the adult social care workforce. And that benefits everybody, has a ripple effect, a positive ripple effect right across health and social care. And without that stability, without that stable adult social care workforce, there's the real risk of a tsunami of unmet need, causing instability right across the system.
The government has said it is putting £162 million into boosting the recruitment and retention of care staff, and that it appreciates their dedication and tireless work.
You know, for many years this has been a workforce that's under incredible pressure, but of course that is intensified at this time, particularly as we have 1.1 million vacancies. There's a lot of competition for labour, so it is a worry, and that's why we've announced this £162.5 million today, which is there to effectively retain and to build extra capacity, and also to bring in thousands of new people.
Whilst welcoming the money, councils and care organisations say it won't be enough. Alison Holt, BBC News.
Let's get more on this now with Vic Rayner, who's head of the National Care Forum. Thanks for being with us once again, Vic. And how do you see the situation in terms of staff in the care sector? And are you very pessimistic that actually it's very hard to fill these shortages?
Well, I'm very concerned, I think, about just how quickly this situation is escalating. You mentioned the Care Quality Commission's report that's out today. And even within its own report, it talks about the increase in vacancies within the sector over the last few months, going up from 6% to 10% in September. And we've just done some research with managers directly in October. And in fact, they're coming back with an average of around 17% of vacancies across services. So it's extraordinarily highly pressured within organisations right now.
And people are just leaving, aren't they, in large numbers, either for more money. They're going for jobs in tourism, we are told, hospitality, places like Amazon paying them £3 or £4 an hour more. Or is it also that they're just fed up with the work and not really being properly appreciated for the work?
Well, I don't know that they're fed up with the work. I mean, the
workload rather than the actual work.
I think that's really important, because you know what this isn't is a sort of isn't people saying care isn't a great sector to work in and the work itself is not valuable. I think the commentary from the Care Quality Commission that staff are exhausted and depleted is absolutely correct. And of course, there's an ongoing cycle of that. So the more people who leave, those who remain are being asked to do more and more work to fill those vacancies. So I think what we've got is a need for some really urgent action. We are calling, I mean, the government has provided some additional funding, and of course it's welcome, but it feels very much like a drop in the ocean. What we really need is some additional resources going into local government to enable organisations to increase the salary for the workforce, and we need a direct retention payment to those staff who've worked incredibly hard over the last 18 months during the pandemic. Every other country in the UK has done that, but in England we haven't even acknowledged or recognised what staff have been through.
But when you say a direct retention payment, is that a sort of bonus effectively?
Yeah, so if you look to Scotland, Wales in fact has paid it twice over the pandemic period, and in Northern Ireland there's been a bonus as well, and we just haven't even looked at that. And of course, if you look at the money that's coming forward yesterday, that can't go anywhere near to acknowledging the efforts that staff have made.
What about bringing in more people from abroad? I mean, the Care Minister seemed to rule out changing the rules on immigration to allow that to happen, but is that one solution?
It's absolutely one solution, and staff, EU national staff, were quite a significant component of the care workforce prior to the changes in rules. They were around about 7% of the staff, and if you looked at specific occupations like nursing, it went up to more like 9 or 10%. So absolutely, they were a key and valued part of the workforce, and the changes in the rules have made that much more difficult for that to happen. I think the other thing that I did hear the Care Minister talk about how this fund might support additional capacity within the sector and thinking about how staff could work additional hours. Well, I was just talking with a member who was telling me about their particular situation. So they have a permanent staff cohort of 2,000 people, and over the last month, those staff have worked an additional 35,000 hours of overtime in that month to fill vacancies. So that, if you broke that down, each member of staff has worked additional 17.5 hours that month, so half a week extra. I don't think those staff have any more capacity within there. We need to do something to thank them, and we need to make it an attractive pay rate for other people who want to come and work in care and are thinking that they need additional money to run their own lives, to make it attractive enough for them to come into care. And we've seen Scotland do that. They've just announced a new rate for all care staff of £10.02. We need that kind of direct, decisive action that's really a commensurate sort of response to the crisis we're facing.
And that crisis is outlined very vividly by the Care Quality Commission. They're talking about a tsunami of unmet need, potentially, uncertainty, anxiety and fear over safety in care homes, as well as serious and deteriorating situation in terms of recruitment and staff retention. It paints a pretty nightmarish picture.
It does, and we're already seeing, unfortunately, organisations having to make incredibly difficult decisions about the people that they're able to support and whether they're able to take in residential settings, new residents either from hospitals or from people within the community, and domiciliary care organisations having to decide whether they can take on new people and meet their needs, or indeed in some cases, as in your clip, whether they have to turn away people that they've previously been supporting because they can't offer the right level of care and support and reliable care and support in terms of having staff available to meet those needs. And this is not, I think the difficulty is when you look at it as kind of numbers, it's easy to sort of brush it aside, but this is people and people's lives, and it's having a massive knock-on effect. We can see it already in hospitals. We can see it in the lives of unpaid carers. If we're not very careful, we'll find that it becomes much more disruptive across the economy, where people are having to come out of paid employment in all sorts of other sectors to provide unpaid care. And we need everybody to be able to be delivering the work that's very important to keep all of our communities going.
Vic Rayner, thank you very much, Head of the National Care Forum. Thanks for your time.
Thank you.